All right, so we're talking about sprained fingers. So specifically these middle joints. These are called PIP joints, proximal interphalangeal joints. So when there's a jamming injury, or even if they're like twisted to the side, the ligaments that support this joint become damaged. They can become partially torn or fully torn in really bad cases. So there's a couple things you can do that are a pretty normal part of a rehab progress. One is buddy taping. So you can, strap them together either literally with tape or there are some pre-made buddy tapes out there that are kind of Velcro. And the idea is that those straps will provide stability to that joint where normally that stability is compromised when there's a sprain. And so it'll give kind of a role model if you tape it to a healthier finger to make sure that there's no lateral forces on them. So that's really common. But one of the main things we see is swelling. So the fingers can get pretty puffy, and which will make it stiff and harder to move. So there'll be a loss of motion. And sometimes it's really hard to get rid of. It can take a really, really long time. So to try to speed along that process of getting rid of that swelling, we want to put a little bit of compression over that finger or fingers. And one of the products that I've used for a long time, the name brand is called Coban, C-O-B-A-N. It's a 3M product. There are a lot of other brand names out there now. But the idea is that this product is, comes in rolls, kind of like tape. And for the fingers, I typically recommend getting like a 1-inch thickness. They come, pretty wide, but for the finger, you really just need like a 1-inch thickness. And it is not sticky. It's a little bit tacky, but it'll stick to itself. And what you're going to want to do is start from the fingertip and lightly wrap around this Coban all the way to kind of the, to the base of the finger, if you will. And the key is to wrap it fairly lightly, actually, because the vessels that drain the fluid out of the finger are really superficial. So if you really wrap it on tight, it may actually feel better because it feels supportive and really kind of hugged, but you may actually be collapsing the exact vessels that we need to have this fluid drain through. So a little bit lighter is better. And really it's wearing that 24/7 until the swelling is gone. And so, take it off to take a shower or whatnot. But if you, wear some compression and, it starts to do its job, and then after 3 or 4 hours, you take it off for an hour or so, this fluid is probably just going to come right back in there. And so the idea is we have to keep that fluid, get rid of the fluid and have it stay out. And so that compression really helps. Top 3 exercises for this type of injury. Again, we're dealing with this middle joint typically, but there's, normally this deformity that kind of tends to happen when these joints stay puffy. Exercise number 1 is a blocking exercise. So what you're going to do is really block all other joints straight, and this includes that middle joint, and really just bend that tip joint down. Nice and slow, bend it, hold it 2 or 3 seconds, 4 seconds, slowly relax, bend it back down again. So I'm not letting the whole finger bend down, locking it all straight, just that tip joint. It's a blocking exercise. We call this joint the DIP, the distal interphalangeal joint. So that's a DIP blocking exercise. Nice and slow. You may feel tension across the whole back of the finger. Completely normal. Second exercise is going to be doing a hook fist. I'll show you with this hand. So this is straight. This is a hook or a claw. You can think of it that way. This is not a full fist. It's just to here. So you can think about almost like coming down on something like a pen. So it's straight to a hook, or as much as you can. If you're getting these fingers, they may be stiff, so you may kind of come to a certain point. Give it a pause for 3 or 4 seconds. You don't want to go quickly because it's the pause where you give that tissue a chance to actually adapt a little bit, chance to stretch, chance to move. If you just kind of bounce up and down, it's going to be net zero. So it's coming down to a hook, give it a pause. You may feel a little bit of soreness. You may feel some stretching in different places. Completely normal. Ease yourself back up. So that's the hook fist. The third exercise is what's called, you can think of it as like a tabletop. And the motion that we're looking at front is, if this is straight, we want to come down to a table, or nearly, not completely level, but pretty close to it. So knuckles are bent, finger, these other little joints in your fingers are straight. And this one's a little bit complicated to demonstrate, to do, so it takes a little bit of practice for it. But the goal here is, you're gonna take your other hand, your uninjured hand, so in this case, pretend my fingers are injured on this side, and you're gonna really kind of create a roof to these fingers. And what I'm trying to do in my injured hand, is I'm trying to straighten my fingers up. So I'm trying to push up, but my uninjured hand is like holding it down. Like, nope, you're not gonna go up, but I'm trying to lift these fingers up. So the tendency is, your fingers may be kind of bent a little bit because of the inflammation and joint damage, or ligament damage. So what we want to do is create this roof, and you're going to try to lift up and push up. 3, 4, maybe 5 seconds, and then slowly relax. Lift it up, hold it, hold it, hold it. So what's happening under here is I'm keeping this, my knuckles are staying bent the entire time. This hand is preventing them from going straight. Big hard lift, 3, 4, 5 seconds or so, relax. And again, this is one where you can definitely feel tissue pulling from the inside. So what that's doing is, it's letting the muscles that straighten your fingers, it's actually the muscles that do this, it's giving them a chance to produce more power. And by holding them down in this position, it kind of creates some leverage for those muscles to produce more power here to straighten your fingers than they can up here. So oftentimes, if your fingers are kind of bent here and you're trying to you're trying to straighten them out and you just can't, chances are it's not going to happen, because in this position, the muscles that do straighten your fingers out are actually really weak. They're really inefficient. But as soon as you bring them down to this and then you activate it, those muscles can really kind of kick in. So we're trying to harness that power by kind of playing with the angles a little bit. So you've got the blocking exercise, a hook fist, and a tabletop. So hope that makes sense. If you have any questions, let me know.